So you're doing everything right with your diet and the gym, and you still can't seem to get your stomach to flatten. After hundreds of abdominoplasty and mommy makeover procedures, I keep seeing the same thing over and over. And it's the same structural damage that's occurred that no amount of training or diet are going to fix. So in this video, I'm going to show you what actually gets damaged during pregnancy, how to know if you're even ready for this procedure yet, and the one timing mistake that ruins more results than really anything else. So traditionally, a lot of people think that a belly that lingers post-pregnancy is just stubborn fat, and that more dieting and more exercising are eventually going to bring back your old pre-pregnancy stomach. And this makes sense because prior to pregnancies, clean eating and harder training at the gym, it worked. Your body would respond. So the logic is just push harder, you're going to end up getting the same results. It's understandable to think that there's nothing different structurally that wouldn't give you the same kind of success. The reality, though, is that during pregnancy, you get separation of the two vertical abdominal muscles. That's commonly referred to as diastasis recti. The other thing that's important to know is there's no muscle in between those two vertical abdominal muscles. So there's no amount of exercise or core work that's going to bring those back to their pre-pregnancy position. Additionally, skin typically gets stretched during pregnancies and often beyond the point where the elasticity is going to allow it to just bounce back. So it's important to understand that you may have a really strong core underneath, but that's not going to repair the abdominal separation or any skin laxity that may have resulted. So you can think of it like you've been training for a fight, your body just can't win. So that can sound like bad news and discouraging, and I get it, but the reality is by identifying what the real underlying problem is, then you can get to the real fix. So stick with me. So one of the primary things that a tummy tuck or abdominoplasty does is sutures and brings those abdominal muscles back to the midline, similar to like an internal corset. It's going to tighten the front of your abdominal wall and also help bring in the waist and give you a better curved silhouette. Removes any excess skin or skin laxity. So more than thinking of it as a makeover, what we're really doing is repairing things that have been structurally damaged, not just addressing the surface. So one analogy to think of is imagine a tent. If the center pole holding up that tent is broken, there's no amount of stretching or tightening the fabric on the surface that's going to fix that structure. You need to fix that center pole and create the structure and stability, and then refit the canvas, and then everything will sit right. So the critical thing, again, understanding is that the break or the structural damage is internal. External effort is never going to be able to address it. The other really important thing is to stop blaming effort for a structural problem that effort can't resolve. So really, we need to kind of have a shift in the question and our thinking and really ask, do your abdominal muscles need repair instead of just additional work in the gym? So that same misread often happens in breast after pregnancies. And the misunderstanding there can result in just as much damage. So very commonly after pregnancies and nursing, there's volume loss or deflation in the breast. So it makes sense. Add an implant, restore volume, and the bigger the implant, you'll fix whatever sagging that occurred. And because of that sort of misunderstanding, people think that the focus needs to be on the cc's or the volume rather than addressing the real underlying structural change that occurred. So it makes perfect sense, right? Something got smaller, it shrank. We need to add volume and just make it bigger and everything will be corrected. Also, when we look in online groups or chat discussions, a lot of the focus and emphasis is often on cc's and volume of the implant. So it's easy to understand why thinking just picking a bigger implant is going to be enough to solve the whole problem. But the real thing you need to understand is that as the breasts stretch and enlarge during pregnancy and nursing, two things happen. We get an expansion in volume and also stretching of the skin. So when we lose that volume, not only have we lost volume, we now have a change in position of our areolas. And as a result, we don't just lose volume, the breasts drop. So adding an implant, although it does restore the volume, it's not going to raise and change the position of the nipple and the areolas. So if we add an implant without addressing the drop, we're just going to have large, pendulous, low-hanging breast. They're going to be bigger, but they're not going to have the proper position or shape. So really important to understand that going bigger doesn't actually lift anything. What we look at is the position of your nipple and areolas relative to the fold underneath. Sometimes people will do what they call, the pencil test, where if you can put a pencil or a pen under your breast in the fold and it will just stay there without holding it, then you've probably got a drop or ptosis that needs to be addressed, and no implant alone is going to fix that problem. So I'm not going to go into or reteach the whole sizing system and how we determine size here, because there's already another video here that we've previously done that you can click on and link to review how we pick the right implant for you. What matters right now is one question almost every mom asks me and the honest answer to it. So the real question is, do you need a lift? Do you need implants? Or do you need both? So it really depends on the degree of drop or ptosis, not just a number of cc's that are chosen online. So again, remember, the lift is going to raise the position of the areolas and the nipple and where they sit on the breast. Ideally, we want the areola and nipple to be centrally located on the breast and at the most projected part of the breast. If you add an implant, but your areolas and nipples are sitting low on the implant, that's not going to have a very aesthetic outcome. Ultimately, the goal is to achieve the ideal shape and proportions that match your anatomy and your proportions. The way we figure this out and decide it, fortunately, we have 3D crysalix imaging that we implement and use during our consultations with patients. What that does is takes actual pictures of our patients and uses them to demonstrate what various specific different implant sizes and makes and models will look like, and what the addition of a lift or not doing a lift is going to do with respect to their outcomes. So you get to choose as a patient from the real reflection of the images rather than just picking based on random sizes or other before and afters that you've seen online. Additionally, Preserve is a new technique that can be implemented in the right patients, which can lead to lower downtime and disrupting less of your internal support structures of your breast. Oftentimes, in the right patients, implants can also be placed over the muscle rather than under, leading to decreased postoperative pain, quicker recoveries, and avoiding some of the other problems that can happen long-term with submuscular or under the muscle implants. So patients need to really stop shopping for volume and start focusing on shape and contour and the position of the areola and nipples in relationship to the overall breast. That shift is the difference between just volume and a beautiful aesthetic outcome. So both of these repairs to the abdomen and the breast share one thing, and it's the reason a mommy makeover gets sold as one thing when it's really another. Hey, if you could take a minute right now to click and subscribe, we'd really appreciate it. We try to bring you honest, no-spin breakdowns that will help patients who are making real decisions which relate to their bodies and potential plastic surgery procedures that they may be interested in. Subscribing is how the next patient will find these videos when they need them. So let's talk about some signs that maybe you're the right candidate for these procedures. So at the end of a normal day, shapewear comes off. There's that drop in the chest once that held-in stomach relaxes and loosens, and our breasts lower and seem emptier than the pre-kid photos that you used to have. So if you've got loose abdominal skin and a pooch in the lower abdomen, those are typically a result of post-pregnancy changes. And as we talked about earlier, actual structural changes that have happened, which are permanent without some type of surgical correction. Also take note, have the breast lost volume, especially in the upper breast, and are things droopier than they used to be? These are very common and very normal changes that happen in all women post-pregnancy. And that's exactly why these procedures are termed a mommy makeover, because they address the two most common areas that change as a result of the pregnancies. So one of the things you can do to kind of test is pinch as much skin in your abdominal area as possible, and then release. Is there overhang and droopiness when you let go? Then you probably have affected the elasticity and stretch of your skin. Second, when you lay down flat and try to do a sit-up, do you see any bulging in the midline or middle of your abdominal muscles? That can represent separation of the muscles or the diastasis recti we talked about. And lastly, have your breasts lost volume, dropped, or a combination of both since pregnancy and breastfeeding? So if you answered yes on the stomach questions, then there's skin elasticity and abdominal muscle separation, which no workout will address. Neither will any kind of topical solution or non-surgical skin tightening modalities like microneedling or oil therapy or soft wave. Those can be helpful for mild laxity, but if it's significant or there's a lot of stretch marks, you're not going to be happy with the results that those products can provide for you. If you answered yes on the breast questions, then the question is, do you just need a lift? Do you need implants? Or do you need both? And if you're nodding yes to both the breast and abdominal questions and tests, then you're probably a good candidate for a combined procedure or what we commonly refer to as a mommy makeover. One of the things that's really important to understand is that mommy makeover is a customized repair, not just a menu to order off of. So when you do it, and in what order often matters more than just checking boxes on a menu. One of the critical things is preferably these need to be done once you are done having children. Of course, sometimes there's unplanned pregnancies and results can bounce back reasonably well. But if there's any thought that you may still want to have more children, best to wait till after you're done. Additionally, we really want the weight to be stable for a good period of time, preferably about 6 months before doing these procedures. If you haven't lost that baby weight yet, focus on that first so that you can optimize your results. So the important point here is it's better to wait and get one great outcome rather than do it and end up having to redo the procedure at a later date. So when you're seeing your plastic surgeon for a consultation, I think one of the things that's really important is to see, is your surgeon willing to be patient so that you can have the best results? I'm always pretty straightforward with this. I try to treat patients the same way I would treat my friends or family members and give them the same advice that I would give them. Sometimes the most useful recommendation and advice that you can give a patient is not yet. Wait so that you can get the best results. And it's difficult as a surgeon because we are obviously incentivized to do surgery. So finding a surgeon who's willing to delay that so that you can have your best results tells you a lot about the surgeon that you're seeing and that you're probably in good hands. It's not about turning away business. It's about helping patients protect their results and minimize the risk of complications as well. So moms who trust that result and are patient come back at the right time and get the results the first time around. So what we want to stop doing is stop framing the decision just based on which procedures. And really importantly is stop scheduling the procedure around some specific event like a wedding or a vacation or something that's coming up. Obviously, if we can do that and get the great results, that's awesome. But the calendar should bend to your body's readiness, not the other way around. And the first thing we need to do before scheduling any surgery is get honest about two important questions. Are you truly done having kids? Is your weight in a stable, healthy, sustainable place? Those two answers are going to really shape everything that comes after. And once the timing is right and you're ready to do this, there's one more thing that makes the whole recovery easier or harder. And a lot of patients don't plan for it until it's too late. So what we're talking about is setting up your recovery before you've even booked anything. And the reason it's important is because combining a tummy tuck and a breast procedure, although you're going to have one anesthesia and one recovery, which is beneficial, it's also a big recovery and it's a big procedure. It includes lifting restrictions. Every surgeon's different. In my practice, I have patients lift no more than 10 pounds or about a gallon of milk for 6 weeks. So no lifting toddlers, no lifting laundry baskets, really trying to minimize any straining that you're going to do after the procedure. And patients who heal best have already built their support system in advance. They're not trying to wing it and figure it out in a panic after surgery. Scrambling for help on day 3 post-op is going to put you in failure mode and not help you optimize your results. So it's kind of like packing a parachute before you jump, not while you're in free fall. Once you're already in your active recovery, your hands are full. Everything needs to be set up beforehand so that you can really optimize your recovery and your results. It's one less thing to try to be dealing with and figuring out when you're already in pain and discomfort. It's going to lead to smoother healing, lower chance of setbacks, and it's going to really give you the ability to rest and heal rather than just forcing you to push through and potentially lead to some complications. Your repair and outcomes are only going to hold if you allow them to go through the natural healing process. So things you can do tonight. So tonight, before this is even scheduled, before your procedure. You got to get ahead of the recovery by going through this simple list. Make sure you've lined up any childcare and a helper to help with that lifting situation and restrictions. Write down exactly who covers which days for the first 2 weeks. Plan your healing support in advance. Ask your surgeon about lymphatic massage, red light therapy, how often you need to do it, and get those things scheduled before your surgery. Make sure that you've stocked up your fridge in your kitchen. You've got plenty of protein. You've got enough fluids for hydration, because your body needs to rebuild those tissues that have been affected during surgery, and it needs protein and nutrients in order to do that. And last, write down your 2 honest answers to point 4. Are you really done having kids? And is your weight stable? So you walk into that consultation ready to go. So some final thoughts. Really, we need to understand that the mommy makeover is a structural repair. It's not a vanity fix or just some procedure checklist that you're going through. The timing, the order, and surgeon honesty matter as much as the procedure itself, maybe more. Always critically important is for patients to understand this is not your fault and it's not a failure because of lack of effort or discipline. These are structural things that no amount of exercise can repair. And lastly, wanting to feel like yourself again is reason enough to do it. You don't need any other justification than that. So the breast decisions of whether you need a lift or an implant or both are where most moms have the most questions. I've already got a separate video on the channel, 8 questions every woman should ask before their breast augmentation. It's going to walk you through exactly what to ask before deciding on your implants or lift. There's a link in the video. Watch that one next if breasts are what you keep coming back to.